Welcome to AXREM Insights, developing healthcare through medtech and innovation. Join Melanie Johnson and Sully Edgington as they talk with our industry leaders and experts.
Hello, I'm Melanie Johnson and I'm here with Sully Edgington. Welcome to Series 3, our partnership podcast episodes. Today we have the pleasure to be speaking to Dr. Katherine Halliday, President of the Royal College of Radiologists, or most commonly known, RCR. Welcome, Kath, and thank you for being on the show and allowing us to get to know you a little better. With our podcast theme being partnerships, I will start by handing over to you to tell us a little bit about yourself and what's your story.
Thank you. Thank you so much for asking me. It's a real pleasure to be on the podcast. So I'm a consultant paediatric radiologist in Nottingham. And I started my radiology training in London and then went to Australia and then moved to Nottingham, actually, when my husband got a job. That's what we did in those days. And I became a paediatric radiologist, actually, because there was a job in Nottingham for a paediatric radiologist and I wanted to work there. And my colleagues seemed very nice. So I thought, OK, well, I'm sure I'll give that a go. And then I did have very supportive colleagues and I've really, really enjoyed my consultant career. I had 3 children, well, during my training, actually, and then obviously continued through my consultant. And then gradually, as they were growing up, I began to get involved in a few other things. So I got involved in the British Society of Paediatric Radiology, which is a great group of people. Very, very vibrant group and very enthusiastic, very informal. And I think working with children always makes you a little bit informal because you never quite know what's going to happen. Unlike a lot of radiologists, we're very hands-on. We do a lot of ultrasound with kids. We do a lot of communicating with parents and things like that. So it's a sort of slightly more in touch, I'd say, with the patients part of radiology. Anyway, after I'd done the BSPR, then I became what's known as the GERFT lead, getting it right first time lead for radiology. So there wasn't a long queue of people. I was the only applicant for that job, but I thought it sounded really exciting. And it was absolutely great. So GERFT is a thing that looks at unwarranted variation in healthcare. And it was started by an orthopedic surgeon, Tim Briggs. What you do is you collect any data you can about radiology and then go and visit radiology departments. It's just in England, around the country, because it's an NHS England programme. And I went to 143 radiology departments with a data pack and then discussed with everybody their data. And then you can see their data in comparison to the national data. So you say, how do you manage to do that and what are your particular issues? And of course the same issues came up again and again, but also people have found really amazing solutions to problems, and so sharing good practice was a really great part of that job. And it was good to usually you had the CEO or somebody from high up in the trust on the board, and sometimes you could really just even sort things out in the room, like you say, well, we can't do very many patients in CT because we have to cannulate in the room, for instance, and then the CEO just say, oh, we'll sort that out. And because actually the healthcare assistants and the CEO had often never been in the same place together, and that conversation between them really unlocked great service improvement. And service improvement is one of the things I really love, and really love working with colleagues. And so it was a great privilege and I loved it. And we wrote a report, which we published in 2020, just sort of round about just after the pandemic or during the pandemic. Then I stood to be president of the Royal College, and I was lucky enough to get elected. And I'm just coming to the end of my second year now. It's a 3-year term, and I've absolutely loved it. The team at the Royal College are just great. The other officers are great. It's really expanding very quickly. The membership's going up, lots of innovation. And I get to speak to all sorts of influential people, and I get to go on the AXREM podcast. So yeah, I'm living the life.
Oh, sounds very, very interesting. So do you have plans, obviously, after your 3 years with the RCR, or?
I'm hoping to get more involved in the QSI project, which is a quality service improvement, what's called quality standard for imaging, which is run from the RCR and the Society and College of Radiographers, and which is a similar thing really in terms of to my GERFT work, and so something I feel very passionate about, and I'm hoping that they will allow me to stay on and continue to have that input into trusts, because I love working with both radiography and radiology colleagues and looking at those departments. And I do think that QSI is really, really important. It's at first when we did it in our department, I was sort of, this is a bit tedious, it's a bit sort of, tick boxy, but actually it's really not at all. It gets you all your processes in order. And actually, you really start to look at the way you do things and realize that you could do things a lot better. And once you have it, of course, it just gives you that reassurance that you are doing well in what is quite a challenging circumstance. So, yeah, so I'm hoping to get involved in that, but otherwise, I'm not quite sure.
Fantastic. And you sound very passionate about what you do. So where does that passion come from, and what are your drivers, Kath?
Well, I always wanted to be a doctor. Being a radiologist gives you the most interesting oversight of the whole healthcare system. Being a radiology manager, it gives you a much better view than other people being in diagnostics. Because, if you're a stroke physician or something like that, you see people as either kind of having stroke or not stroke, if you see what I mean. But we see the whole system. We see primary care, we see secondary care. We really see how it all works together. And we also see the kind of how the barriers or the divisions between systems are not really divisions. So, for instance, people, when they talk about healthcare, they'll talk about acute care versus outpatient care. But I mean, actually, it's all coming from the same pot. So we really understand how one affects the other. And so we have great opportunities to influence the whole system. And that is very satisfying. I mean, I believe passionately in the NHS. It really is a wonderful system which really delivers a lot for us. And in terms of equality and access, health inequalities. I mean, there's still a lot of work to do, but it's a lot better than a lot of other countries. And so anything that we can do to make that work better, I'm up for that.
Fantastic. Thank you.
Okay, so what are you kind of the RTR's main challenges and commitments for the next few months?
So, I mean, the challenges remain the same in some ways, in that it's workforce. So last year, the workforce increased by about 6%, but actually the number of MRI and CT scans performed increased by about 11%. And so, I mean, although we are increasing the workforce, the gap continues to widen between reporting and production of images, and the great work that you and your members do to make MRI and CT faster and better and generally produce more is a bit of a headache for us because we can't deal with it. Not that it doesn't need to be done. So, workforce to try and keep it up. So we need to increase the number of trainees in the UK, and we do that. But of course, the challenged position of trusts in terms of finance makes it very difficult. They only have to fund 50% of the post, but actually they often find that very difficult. And also training capacity is an issue. So one of the things that we need to think about is how to maximize the time of our trainers and make sure that they are able to deliver as much as possible. At the moment, there's quite a lot of duplication across different training programs, all delivering the same stuff. So we need to try and work on that, and also use technology to do some of the hard yards in terms of training. So simulation, that sort of thing. So training needs to be a big focus for us, training of UK graduates. We also do a great deal of, we're very lucky, we attract a lot of graduates from abroad, international medical graduates. So we're very lucky. We actually, for our training program, last year, the number of applications was 12 to 1, 12 applicants for every place. And many of those are international medical graduates, but international medical graduates also join later. And so we're lucky to be able to attract some of the brightest minds from across the world. But there is some work to do with onboarding and supporting people when they come from abroad, because working in the NHS is very different. That's the first thing. Workforce is always a big focus for us, and also protecting our workforce, because you can imagine that with that increase in workload and being unable to keep up, our workforce really suffers, really feels the pressure, and we're seeing people retiring earlier and earlier. And so that is a problem. We need to really advocate for improving people's working lives. And actually, one of the things that really affects people's working lives is IT and technology. the frustrations with the poor interoperability, very old hardware, that people find that very, very hard. And it's one of the things that drives them out, actually. So we need to take care and look after people. And then, of course, that brings me neatly on to the digital agenda, which is huge for us, absolutely huge. How can we implement AI safely into the NHS? How can we ensure that we improve the outcomes for patients' productivity and also our own working lives? Because actually, if you think about a lot of the digitisation of the NHS, it actually has ended up making us a little bit less productive. And so if you look at doctors, for instance, so in the old days in an outpatient clinic, this isn't in our field, but in the old days in an outpatient clinic, you used to have these secretaries sitting next to you who'd write all the letters, request all the stuff for you, follow everything up, and you could concentrate on the patient. Now that doesn't happen, and people will have to, request the blood test themselves. I mean, that's all on one system. Well, actually, it usually isn't. It's often on a separate system, but they'll have to dictate the letters, they'll have to sign them off, they'll have to request the blood tests, they'll have to arrange any follow-up. So actually what we've done is probably more efficient because it's all on the computer, but actually the work has been transferred from a secretary to a consultant. And actually consultants can see far fewer patients in the clinic now than they used to be able to. So, we have to be quite careful with digitisation and AI, that it's actually producing what we need.
Yeah, no, I totally agree. And I think, as you mentioned, AXRA members supply a lot of innovations into the NHS. And we see when you think about a mobile phone in simple terms, what it looked like 10, 20 years ago to what they can do and what they look like now. And it's the same with the product and services that AXRA members provide. We see that, like you say, scanners are lower dosage, they can scan quicker. And, that's only going to improve over time, hopefully, and help create some of those efficiencies that will help with the workforce. And I know that we've been working with the RCR, and you guys sit on our AI special focus group, and I think that leads quite nicely into the next question. So AXRA are proud partners to the RCR's new AI conference in February 2025, which I'm personally really looking forward to attending. Can you tell us a little bit more about the event and what we can expect when we attend?
Of course, we're very, very excited about this event, and we've already had a great deal of interest. We're partnering with yourselves and lots of international radiology societies as well. And of course, one of our main partners is also the NHS AI Lab, because you will, and your members will all be aware that the UK government has invested quite heavily in looking into AI and its introduction into the NHS with the AI Awards and the AI Diagnostic Fund and the AI Diagnostic Platform. So these are all big investment projects across the UK, and it's been going on now for a few years. So the AI Lab, the NHS AI Lab, want to showcase the results of these investments, what's worked and what's not. So it's not just radiology, there'll be dermatology, there'll be ophthalmology, and many, many partners from the other Royal Colleges, the work they're doing. So it's a coming together of all the NHS AI work and also input from global partners to say what they're doing across the world. So it's going to be held in central London next to Westminster. We're very much hoping that the new government will be involved. It's slightly early days yet because they've got quite full diaries, but it is an area of interest for them. And of course, the AI agenda is just, this is going to be a very big conference. So I'm not sure how many people will get, but certainly we're hoping for sort of 900, something like that. Maybe more than that, actually. I'm not very good with how many people we're expecting. It's going to be a big conference. And of course, this is a real theme for the government. We can't just keep going the way we are. We can't work in the way we're working because there aren't enough people in the world to supply all the healthcare we need, and the demands are only going to go up with an increasingly aging population, multi-morbidity, increasing expectations. So we've got to do something differently, and working on pathways and digitisation has got to be the way forward. So in terms of productivity, this really ticks the government's box, but also in terms of growth. I know that Mr. Streeting's been saying, we want to see the NHS as an organ for growth. And if we can get ahead of the game, create an environment in which innovation can flourish, then we can be world leaders. We have a huge opportunity in the NHS because of our unified system. And a lot of that will be about infrastructure and data to create the environment in which innovation can flourish. But if we could do that, that really would be a stimulus for growth in the UK and would make us into world leaders. And this is what we will be advocating for. And the conference is a good way for us to showcase the work we're doing and the way we're leading this field.
Absolutely. And we're hoping as AXREM to launch our AI manifesto at the event as well, which is very exciting for us. You mentioned about Wes Streeting. I'm sure he's got the biggest inbox ever at the moment because everybody wants to speak to him. But what I think we've welcomed is he has kind of really hit the ground running, and we've seen some announcements sort of quite quickly. I think my concern has been we've seen the pledge from the Labour Party as part of their manifesto to double scanner capacity, but the saying there's not enough pilots to fly the planes really does come to mind when we think about that. So I hope that it's a well thought out strategic approach if they want to double the scanner capacity, and they also look at the aged assets and things like that, because I think that's really, really important moving forward. So yeah, just my kind of view on that. So looking further ahead in a horizon scanning, what do you think are going to be the biggest challenges that you see for your RCR members in the future?
RCR members are pretty good at keeping up with new innovation, but there will be a lot of that to do. Since I started, MRI was quite a new thing when I came. So look how that's developed in the last couple of decades. So, we're all quite used to keeping up with new stuff, but the rate at which new stuff comes on the line is going to be a challenge. I think also radiologists will be more and more increasingly leading the team as things become more complex. I think what you need is people to look at everything you're doing and work out whether you're using your resource in the best possible way. So I think leadership is a big theme, actually, for radiologists. We can't just be doing everything ourselves. We'll be leading a wider team of people who are doing things. We'll be getting inputs from our advanced practice colleagues, from computers, and our role will be in leading, working out what the best pathways are for patients, looking after the team, teaching, training. So I think that is going to be a big thing. And not everybody went into radiology wanting to do that. So I think we need to develop those leaders, ensure that they have the time to do it, the time and the resource. So I think that's going to be a big challenge, actually. And just balancing the demand is very, very hard.
Do you think that some technologies and innovations enable you to have more time with your patients? Because that's what I would hope from technology and innovations.
Well, I would hope so. And I think that's one of the leadership things that we need to do to ensure that our technologies really do that for us and they're hitting the right place. And so we need clinically to be leading the market rather than, in some cases, the market kind of leads the other way around. Do you know what I mean? So we need to say, we've got a problem that needs to be solved. Can you help us with it? Rather than somebody coming along with the technology and saying, how can we use it? Because as I've mentioned with the kind of outpatient thing, it's really possible for technology to actually make things slower. And of course, that's right. If you've got, for instance, a new MRI sequence that shows you additional information, of course, you're going to have to look at more images and it's better for patients. But there's a balance and you have to introduce things in the right way. So and we have to look at where we're going to get the most benefit for this investment. But definitely that's what we should hope for. And I mean, things like auto contouring, for instance, in clinical oncology, I mean, that saves time for the staff. Definitely, instead of having to do the contour yourself, someone, the machine does it, as it were, and then you just tweak it. So that's, those are time savers.
Yeah. And I think as well, industry's got a role to play there in making sure that all of the staff that use the equipment can use it to its maximum potential, and I know that our members put a lot of time and effort into training in the NHS, and that's a core part of their business as well.
And I agree that we really need to work very, very closely with industry over these things. And it's all about ongoing support as well, not just a one-off. Yeah.
So now for my quirky question. If you could hang around with any famous person, dead or alive, who would it be and why?
I think it would be Nelson Mandela, because I do think leadership is so, so important. And actually, that is a fundamental thing of an oncologist and a radiologist role. And also for me personally, obviously, it's quite a big thing. It's easy enough to influence people who are around you, but how do you extend your influence to people further out than that in a way that is accessible to them and actually facilitates change? And I mean, he was facing an impossible task, but managed to do it. And I feel a little bit that we have got a very, very challenging task. But how do we make those people, all the wider membership of our college, how do we make them feel that it is possible, that they can be part of it and that we can do it together?
Absolutely. And I was actually asked a similar question recently, Kath, at UKIO, and we were talking about kind of women in leadership within the medtech sector and how we can encourage more women. And I was just like, it's people like yourself and myself leading AXREM, that we're leading by example, and we're putting ourselves out there to, I think this is a fantastic industry to work in. And, I hope I live my career out with AXREM, because the fantastic work that our members do. And we are seeing more kind of female leaders come through, but still, there is that gap. When I joined AXREM, I sat around a table with mainly men, and it's actually, we've become so much more diverse over the last few years, which is really, really good. And things like our Future Leaders Council has helped with that as well. So, I absolutely understand why you choose Nelson Mandela, very inspirational guy. And I think that your role leading the RCR is also inspiring lots of people as well. Thanks for that.
I think you're doing a great job, Sally, and I agree with you. It's about role modeling, and you just have to feel strongly and passionately about things and listen to advice. And yeah, I think you've got that in spades. So I think you're doing a great job, and we love working with you.
Oh, thanks, Kath. So thanks ever so much for your time today, Kath. We really appreciate you speaking to us. Thanks for being a guest on today's show, and thank you to all the listeners.
My pleasure. Thank you.
Join Sally and I next week when we will be speaking to Catherine Kirkpatrick from Bemis. If you have enjoyed today's podcast, don't forget to hit subscribe, or feel free to share the podcast with friends.